So a lot of people think that they have celiac disease because they got a positive blood test. But is that really true? So celiac disease is when your body mistakes gluten from wheat for a virus and starts attacking the wheat thinking that it's a virus. And in the crossfire, your small intestine gets damaged. The villi, which are finger-like projections, get attacked and they blunt. They become flat. And so your food doesn't absorb and you get bloating, diarrhea, and just feel nasty whenever you eat wheat. So there is a blood test that you can have checked with your doctor called a TTG-IgA, basically a celiac panel, looking for antibodies towards gluten. And if this test comes back positive, the best thing to do is get a biopsy done by a gastroenterologist, meaning you have an upper scope done where you go down with a camera and look at the esophagus, stomach, and the first part small intestine. And down in the small intestine, we take biopsies that we send to see if you have that flattening in your villi. Now, you get some people who are afraid to do the biopsy, and so they say that, well, I had a positive blood test, so I must have celiac disease. I'll just go gluten-free. Well, I'm going to tell you, you are going to want to get that gold standard biopsy. First of all, celiac is a lifelong diagnosis, and so you don't want to make that commitment unless you really know that you have to. Second, there are things that cause a false positive celiac blood test. And one of the most important ones is H. pylori infection. So H. pylori is a bacteria that is very commonly found in the stomach. This infection in the stomach can lead to ulcers and, if untreated, stomach cancer. And so it's very important that that get checked out. And that's another thing that we find on upper endoscopy. And other causes of a false positive celiac blood test can include Crohn's disease or other autoimmune conditions. And so you do want to have those checked out as well. So just because you have a positive blood test doesn't mean you necessarily have celiac, but it does mean that you need to see a gastroenterologist and have an upper endoscopy done to make sure that you know what you're dealing with, because you're going to want to know that you've got the right thing. So if you have any questions, please leave a comment below and subscribe for more stories like this. Thank you.